Brian, what tips do you have for new interns in Clinic A?
What's Clinic A?
Welcome to Clinic A. This is where we start. Wave hello to the clerks. When you first come in, you'll take a quick right, check your panel. Here on the right, you'll see one of our residents hard at work. And you can see on here your panel for the day, where you'll get all your charts dropped off and be able to check in on which patients you're going to see right away. After you've seen a patient in your room, you'll present to an attending. The attendings hang out in this back corner here. There's Dr. Rotblatt hard at work right now.
Oh my God.
What does ATEMM even mean?
Accelerates training and excellent medical management.
Okay. Automated teller electronic medication machine.
Antiquated technology enabling medical mistakes.
Application for torture, enduring misery and misfortune.
The next section is on how to use ATEMM. Click the icon on the home page. Enter in your username and password provided to you by Gus. And after reaching the home page, just be sure that you are in the correct clinic. So you can find that out by looking in the left corner. Next, you can click make sure your page is in the active tab and select your patient. If your patient is not listed under the active tab, you can click the waiting tab. And you can select your patient's name and then select bring back, enter a room number, and then your patient will now appear under the active tab. So once you select your patient that you are going to be seeing next, you click their name and you click on MD function. You select sign up MD. You select that icon and then you enter in your name and you select your name. And once you do that, the clinic order form will print out and now you're ready to see your patient. Alright, that's that part. Click on the medications tab. The patient's chronic meds are listed in the center column under recent med activity. To stop a med, you can click on the stop button and that'll go to the stop column, which is on the left. To refill a med, you can click on the rapid refill button, which will take it to the continue column on the right. Now, if you decide to start a new medication, you can click on the add home med icon. You can enter in the medication's name. A list of medications with the starting letter will pop up, and you can click that name. And just be sure that you select your supervising physician. And after you do that, you can click on that medication. It'll be listed under the recent med activity, and it'll go to the right column for you to continue. So after you decide to continue meds, be sure to edit your prescriptions for your desired quantity and number of refills. And you select change printer just to be sure that the assigned prescription printer is correct and you are able to print your meds. Be sure that both you and the attending sign the prescription. To discharge a patient from clinic, select disposition. Click RN Dispo. Be sure to reconcile your meds, and your patient is now safe to be discharged home. After this, just be sure to put your chart and your prescriptions in the RN Dispo section in the front desk.
Oh, you forgot your password to ATEMM? Just remember, when you enter a new one, you got to write a riddle, a haiku, your social security number, scrambled and upside down.